The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make Good Medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hi, this is Good Medicine. I'm your host, Larry Pitts. Today I have one of my distinguished friends and guests is Barb Plouffe, public health nurse for the Ronan district, if I remember. Ronan Pablo. Before we get started, Barb, I would like to do a public service plea. And we are asking for donations from anybody out in the viewing audience to the Second Circle Center, our foster care program. We need topsoil. We need plants to make it look a little better inside. We need pictures, things to spruce it up to make it a little bit more like home. It's so sterile there that it makes you feel sterile. So, Barb, let's bring you into the conversation right away.
Okay.
Who do you want to say hello to today?
You.
Cool. Hi, Barb.
Hi.
How are you today? Good. Barb, the reason we brought you on today is we want to talk to you about immunizations. That's a mouthful of a word, but I hear that we are very good at it within our system. Why are these so important?
Disease preventable vaccination or immunizations are really important. The disease themselves, we do not live in a time when we know the results of these diseases because of the immunization, the polio, the paralysis, people dying from measles and diphtheria and that type of thing. And part of that is because of the immunizations. One of the things that is happening, though, around us, although our program generally runs somewhere between 92 and 96% immunization rate in a quarter of childhood immunizations, is around us there are outbreaks. There's an outbreak of measles in Canada. Right now there's 490 cases. There are 8 cases in South Dakota, which 6 of these are adults and 2 are children who are unimmunized. I believe one's a 12-month-old and one's an 18-month-old.
Now, what kind of measles are these?
Just the regular old measles.
Okay, is that the German measles? Or?
No, the hard, what we used to call the hard measles.
Okay.
The hard measles.
Okay.
And in an area where there's less immunization rates than here, it becomes a real problem. My understanding is that in Canada they only require 1 dose of MMR, measles, mumps, and rubella, where in the state of Montana you are required to have 2. The other thing that's maybe of a greater concern to us is the pertussis, otherwise known as whooping cough. There are over 190 cases in the Coeur d'Alene area, Idaho, of which a 2-month-old child has died. We did have a case of pertussis on our reservation within the last month. This child did have 1 immunization, was on schedule, and it takes up to 3 of the series to make the child immune. So it's here.
On this child, did it happen because they weren't on time with their shots, or just it hit in that window?
They were on time. The child was 2 months old, had its first immunization, but because of the way the immune system works, its immune system wasn't up to snuff because it hadn't had the 3 series, which goes over a 6-month period. As close as we can tell, this was a contact from somebody out of state, but it was here. There was major follow-up on it, and now we're just waiting to see if there's any resulting cases from that.
Now, are there any precautions that the general public needs to be made aware of? Or?
Yes, there was a real good letter in the Leader that Dr. Campbell wrote, who is Ralph Campbell, who's a Lake County pediatrician. And basically what he said is if you have a child that has a lingering harsh cough, you need to really take them in and have the doctor, and by lingering I don't mean months, I mean a few days. And if it's a real harsh cough, whooping cough has a characteristic whoop, but that's not always true. It doesn't until they get into the later stages of that. So at this point, if you've got a question about your child and having a weird cough or a cough that you think is a little longer than that, you need to take them in. And whooping cough can only be diagnosed by a culture. You cannot diagnose it by saying, yep, they got it.
Now, do they spike a fever? Or?
They can spike a fever. They can have all kinds of cold-type, flu-type symptoms on that. But the big thing that really is cough, and they just get to coughing so hard that they can't get their air. You know, it involves the respiratory system quite severely. So, you know, call your physician.
Precaution goes a long way.
Precaution goes a long way, and you know, we have had a case, so be a little bit cautious during this time.
No panic, though. I mean,
no panic.
You know, it's not an outbreak, epidemic.
No, it's a one case, and as far as you know, we'll soon know if there's a second case related to this because of the communicable period, and we're just waiting on that.
Okay. Barb, you know, the diseases that can be prevented with immunizations, does it actually prevent them, or?
It actually prevents them.
And which ones are those?
There's a number. There's polio, which some of the older residents of our area know very well, and some of them had it. There's hepatitis A, there's hepatitis B, there's measles, mumps, rubella, diphtheria, tetanus, pertussis or whooping cough, Haemophilus influenza, which can cause meningitis, especially in children, pneumococcal pneumonia, and of course the influenza. There are others out there, but those are the main ones that we deal with on a day-to-day basis in this area.
Well, I got a question about influenza. You know, I mean, every year they come around, they give you shots, and it seems like sometimes when you get the shot it works. I guess sometimes it doesn't work. Why is that?
Well, when they do the influenza vaccine, it's kind of an educated guess as to which 3 strains are going to be the worst.
Okay.
And then they develop a vaccine, start developing a vaccine for that early on in the spring, so it'll be ready in the fall. There are numerous types of viruses and bacteria that can cause flu-like symptoms. If they're not in those 3 types that the vaccine's for, you're going to have the flu.
Okay.
But they're looking at the ones that they think is going to cause the most problems with people, and that's the one we use the vaccine for.
Okay, now there's someone out there in TV land right now sitting on the couch saying, I took that shot and I got that flu, I got it from that shot. Is that true?
No.
Why not?
Because it's an inactivated vaccine, and a lot of them go back to the old swine flu, and they, you know, that
I was in college when that happened, by the way.
Yeah, that was a live vaccine that they actually gave to people. That's not true these days. And so we hear that all the time. Yeah, I got the shot, I got the flu. It's probably not from the shot. They were probably getting the flu, and it just coincided with the day that we were there doing our thing.
Sounds like a country western song.
Yeah.
I got the shot, I got the flu.
Yeah.
Sort of rhymes, you know?
Yeah.
You know, you went over the different vaccines as far as the things that can be prevented. When I heard that whole list, is there one shot that covers the whole gamut so that people don't have to go in and keep getting stuck and this kind of stuff?
I wish. No, there are some combinations. The measles, mumps, and rubella are one shot. They're combined into one shot.
That's called an MMR, right?
That's called an MMR.
They're pretty smart, aren't they?
Yeah. There's a DPT, which is a diphtheria, tetanus, and pertussis. That's a one shot. There's a combination of diphtheria, tetanus, pertussis, and the Haemophilus influenza shot. That's one. But those are the only ones right now that are a combination. Other than that, it depends on how many you need, how many you get.
Now, it sounded like those were 3 different shots, so that's 3 different shots. When my kids were little, I know they had to go through this whole cycle, and I remember getting the card from you in the mail, and whenever it came in, I made sure that I was out of the country when my wife had to take my child in because I hated to watch him cry. And what is that schedule?
This one here, and it changes by the day, but this is the latest schedule that we have printed. The HB is hepatitis B, and they can get that at birth.
Okay.
This is a fairly new...
Before you take them home.
Before you take them home, right. Excuse me. At birth. Then at 2 months, they can have the second hepatitis B, the first polio, the first DTP, and the first, this is for the Haemophilus influenza. It's called Hib. Then at 4 months, there has to be a 6-month spread between the second and third of the hepatitis B. So depending on what your schedule was, whether you'll get a hepatitis B at 4 months or not, then you get a second polio, a second DPT, and a second Hib. Then at 6 months, you probably will get the hepatitis B, the polio, the DPT, and the Hib. If somewhere along the line, the hepatitis B, you do a catch-up kind of thing. Then at 12 to 15 months, they can get the DPT Hib, or they can get the DTAP and the Hib and their MMR. Then somewhere between 4 and 6 years, they need the polio, the DTP, DTAP, whichever we use, and the MMR. And then after that, every 10 years, they get you need to have a tetanus. Even us need to have a tetanus.
You guys. Okay, now, so when I look at that list, that seems like a lot of shots.
Well, it is, and the polio here is oral. Now there is...
That means you take it by the mouth.
That means you drink it by the mouth, right. There is an injectable polio that we do use sometimes, depending on the situation.
My children had to have that?
If you live in a household where there's someone that's immune suppressed, you cannot give them the oral polio. You have to do the injectable polio. The DTP and Hib is a combination. So using this right here, it's 1 shot, a liquid, and another shot. Or it could be 4 shots, depending on the vaccine that you have on hand.
You can't mix them.
Can't mix them.
Okay. Is it true that you nurses love to give shots?
No.
Oh, okay. Well, I always hear you guys laugh about it.
Well, you know, I'm a firm believer in them because of the diseases that they prevent. And, you know, I appreciate the parents that don't like to get their kids shots, and I really appreciate them when they do come in on time. Part of that laughter is part of nursing. You know, you use a lot of laughter to cover up a lot of things, kind of thing. But I really think it's important for them to have the shot. All it takes, if you know somebody that had polio, you know, all it takes is to know that person and know that we could have prevented.
Yeah, my brother Gary actually had polio.
Yeah.
And he's sort of brain dead. I can say that he's my brother.
I was going to say, you said that.
That's right. I want to ask you something, though. You know, I was standing, it seems like I always talk about this, I'm standing at the grocery store and I'm reading the magazines there. And I remember one time I was talking about the immunizations that we give our young people actually destroys their immune system and makes them more susceptible to the disease, and there's no evidence now that it's protecting us. Is that true?
Was that the Inquirer?
I can't mention that.
No, it's not true. It boosts the immune system to fight off the diseases is what it does. And there are a lot of people out there who claim that part of the outbreak in Idaho may be related to that because there's a big population that don't believe in immunizations. The last outbreak that they had in Montana, I believe it was rubella, was related to a group that didn't believe in immunizations.
Okay. So what you're saying to me is that you truly believe in this. You have the evidence behind it. You know that I've seen the studies. And I'm with you. I believe in my children have the shots, but I know there's some people out there probably watching this right now who are saying, oh, this is a government conspiracy type of thing.
I'm sure.
Are you employed by the government?
I'm employed by the tribe.
But your heart's behind this, isn't it?
You know, whether I was employed by the tribe or private employment, I would still be pushing this, yes.
All right. Well, see, that to me is a lot of credibility. You know, you were mentioning hepatitis A, hepatitis B. I thought it was just hepatitis.
Well, hepatitis is a word that says it affects the liver.
Okay.
Hepatitis A is a virus that's passed through, mostly through food and water. And the biggest way that that happened is passed out of the body through the stools. People go to the bathroom, don't wash their hands, they're infected with the hepatitis A, they don't wash their hands, they go back and fix somebody something to eat. Somebody eats it, they get the hepatitis, and it's on a roll like that. So one of the best ways to keep from spreading hepatitis A is hand washing before and after bathroom, before and after anything that might contaminate other food. It's a series of 3 shots, like I said on there, and it's a series of 3, whether it's infants, adults, adolescents, whatever, and it's recommended for children over 2 years of age, anybody over 2 years of age. Now, hepatitis B is passed through blood and body fluids, and this is one of the things that goes kind of along with the AIDS epidemic. There's a lot of hepatitis B because of IV drug use,
right.
Multiple sex partners, this type of thing. So it's a different thing, and they affect the body differently. The hepatitis B is much more deadly than the hepatitis A. It's a series of 3 shots. We are giving them to infants now, but the adults can get that, and it's really recommended for anybody that's in healthcare, policemen, firemen, anybody that in their line of work possibly might come in contact with blood or body fluids of any type.
Yeah, my family got exposed to hepatitis A in Missoula a couple years ago, and my daughter hates needles. I know when the nurse came at her to give her vaccine for that exposure that she was running out the door, and I asked her at the time, I said, honey, where were you going? She says, Dad, I don't care. I just wanted to get out that door away from the needle.
And that vaccine that she's got is just a stopgap. It's only good for 3 months.
Right.
It just helps your body fight it off. It doesn't prevent it.
All right. Well, Barb, we're going to take a quick break here for our Let's Ask Marjorie segment. So we're going to take a break. We'll be right back after this segment. Thank you. This is the Let's Ask Marjorie segment of our program. Today we're back with Marjorie Bear Don't Walk. And Marjorie, in my travels on throughout the reservation, one of the new things that have been coming up a lot lately is this thing about a restricted list with the physicians. Would you like to address that for me?
Yes, Larry. I've had several complaints, and I've been very confused about it also. I was not aware that since the days of the Indian Health Service that there's a committee that puts people on a restricted list for pharmacy. And while I'm not opposed to that, I believe that there are lots of people who probably need to be getting their medications at one facility so that someone is able to monitor interactions and the number of medication and all that kind of stuff. But I've been told by several people that there are doctors who are refusing to give them health care, that after they check their file and they see these letters or these lists of people on the restricted list, that they are refusing them service. Now that offends me in two areas. One, even if you are a drug user, an alcohol user, a smoker, or whatever other kind of abuser you are, I believe that we are paying for health care for you, and that if you have a health problem, you should be receiving health care. And I'd like to make that really clear, that I will not tolerate the clients not receiving adequate health care for whatever reason. And if they had a broken leg and a broken arm, you wouldn't look at their broken leg and say, well, I can't treat your arm, you know, because your leg is broken. And it's kind of like this with the drugs or alcohol or whatever it is, that certain moral judgments are being made, and I don't like that. But the second part of it is there appears to be lists from over the years, as far back as 8 or 9 years, of lists that are either in people's charts or at hospitals or with doctors. And if these people are on there, it appears that they never get off the list. And so I would like to ask anybody in the viewing area if they are a doctor and they know of any of these lists that are in anyone's charts, or to send them back to me. The same for the hospitals. I also would like patients who are having those problems to get in touch with me. I believe that it is a violation of these people's civil rights in most cases. And so I would like to clear that up. I'm not opposed to clients being restricted to one pharmacy or at least one computer system in a pharmacy. But I am opposed to people being on lists that where they're judged from a moral standpoint, and they're not receiving health care.
So we're looking at infringement on your rights for health care, and if you feel like you've been abused or been neglected basically because of this aspect, to get a hold of you at Tribal Health, which is 745-3525 or 1-800-823-8228.
Really good, Larry.
All right. Thank you, Margie, for being aboard, and for those out there, thank you. Hi, we're back with Barb Plouffe. We're talking about immunizations here on the reservation, and I think, Barb, from now on, we're just going to call this the Barb Show.
Oh, yeah,
You're doing such a good job. Barb, are there new vaccines that we have to worry about?
Basically, there's not new vaccine that we have to worry about. There's some changes in the vaccine. Like I was saying earlier, the polio can be given injection now instead of the live polio. There is hepatitis A, which we've talked about. There is a chickenpox shot out there, and that is recommended for children over 12 months. And then there's the DTaP, which the A stands for acellular pertussis, and it causes less side effects from the pertussis.
Okay. You know, when my children went through their series of shots, and obviously Tater's still not quite done. He's not going to like that. They did spike a fever, had some symptoms and stuff. Are there any things that can help relieve those symptoms, or?
Tylenol, we recommend they give them a lot of, maybe even before they get the shot or right after it. And they can have that every 4 to 6 hours during the first 24 to 48 hours. That seems to help. Some warm packs to the site of injection. Playing in the bathtub for the older kids is always a good way. And especially kids, the more you can get them to run and play and move around, the less local reaction they seem to have.
Disperse it?
Yeah, it just seems to help.
Okay. What about the adults, you know, the attitudes that we have? What can we do about that?
Well, that's a good question of what the attitude can do, because adults really do need immunizations, and we frequently forget that. They need a tetanus every 10 years. Adults should have 2 MMRs, especially if you're born after 1957, you need those. The Pneumovac, older people, people with health problems, the hepatitis B if you're a healthcare worker, and the hepatitis A is a good one too, and then the influenza vaccine, which comes around yearly.
So now, I always hear people saying, well, geez, I'm sick, I can't go get my vaccination now, I can't become immunized. Is that true?
No.
How come?
There's lots of reasons, but the big thing is that mild sicknesses do not prevent you from getting immunizations. Being on antibiotics doesn't. Having ear infections doesn't. There's only about 2 or 3 real true counterindications. There's some times when you want to delay them a little bit, but and those are people with certain health issues or people who've had an anaphylactic reaction to a shot. Then we don't want to give those again.
Chris, now what is a mild sickness? Whenever I'm sick, it's the worst in the world because I'm feeling it.
Well, we look at how high is your temperature. Do you look sick? I mean, you
I normally do.
Yeah. You know, you can. Especially kids, they come in there, you know, their moms or dads will say they're really sick, and these kids are, you know, climbing the walls and running all over. We'll probably try and talk them into going ahead because they're not actually acting sick. Yeah.
Now, what about requirements within the school systems and daycares? Does Medicaid have requirements? I mean, everything is so regimented anymore.
Yeah,
what are those requirements?
There's some very specific requirements to get into the schools in Montana. You have to have 4 DPTs, and 3 polios, the last one after you're age 4. You have to have an MMR to get into school and a second MMR somewhere around 4th or 5th grade. Those are the ones that are actually required. Head Starts and daycares pretty well follow according to the schedule, and they really like to have the Haemophilus influenza shot because that's the age that kids are more likely to get meningitis. And the new Medicaid laws, if you're getting welfare, you have to have your children up to date on their immunizations according to schedule.
And what if they aren't up to schedule? What's that mean?
Well, I don't know what, as far as welfare, I'm not sure what what they're going to do to the people, but I know we're getting a lot of them that are filling out their cards, bringing their kids in to have immunizations. There are religious exempt and medical exempt, but they have to be signed and notarized that these are true beliefs.
Now, okay, now who signs and notarizes that? Is it your principal or?
Oh, no. Medical has to be the doctor, and there may be a reason. And religious exempt has to be signed and notarized by someone from the church, your minister, your preacher, your priest. A parent just can't sign it and bring it in.
Or the child can't sign it and bring it in and say, I don't want to get this shot.
No.
I tried that in school. Okay.
Didn't work.
Didn't work very well, that's for sure. Where can you get accurate information? I mean, regarding all this information, on immunizations, how do you keep track? I mean, I can't remember when I got my shots.
Well, we have, for those people that are covered by tribal health, we have a file that we keep up so you can get, what you've had in there. There's some, the local health departments are the ones, we all follow CDC guidelines. The doctor's offices are a little bit, they don't follow quite as stiff of the CDC guidelines that we do. There is all of the tribal health department, public health nurses have this information, and also the Lake County Health Department follows these guidelines.
Okay, so there's basically a set protocol that you are following. There is a reason for that. Why do you say there's a reason for it? For the list and for following?
And for following, for complete coverage. If someone doesn't follow them, be it yourself, or you follow it for your children, or you have a public health nurse whose job is to make sure that these are up to date, we get lax, we forget. The first 3 shots are generally pretty good because they come every 2 months. But then there's a 6-month space in there, and you get busy and you forget. Same way with an adult for hepatitis B, you get one, a month later you get the second, but then it's 5 to 6 months before you get the third one, and you just kind of space it out unless you mark it on something. So. Yeah.
And that is so true, Barb. I mean, I sat there and I looked at that and I realized that Taylor still got 1 more shot to go, between 4 and 6, and Whitney's done until she's older, but in case she gets a flu shot. I want to thank you for coming on. I think what you brought aboard here today was a lot of information that we can be presented to the public. They can take it. Where can they get hold of you guys?
You can call the 800 number down in St. Ignatius, 1-800-823-8228. The Ronan Clinic is 676-0137.
They'll flash it.
Put me on the spot for the
That's
other
right,
2 clinics.
that's right.
Lake County Health is 883-7288, but the Polson and Ronan, I don't have those numbers written here.
Okay, Barb, well, I want to thank you for being aboard, and for those out there in TV land, thank you, and we will see you next week. Thank you much.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care, and we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at